Hi, everybody. My name is Jessica Carrillo. I am Telemundo's Al Rojo Vivo co-host, and it is a pleasure to be right here with you guys on this important matter that we're going to be talking about ahead. Earlier this year, we partnered with Susan G. Komen in our effort to raise breast cancer awareness across our Latino community. And this partnership is comprised of a 2-year effort to reach our Hispanic women with trustworthy information and resources to take control of their breast health. As breast cancer is a leading cause of cancer death among Hispanic women in the U.S., it is really important for us to talk about this matter. And particularly, we're going to be talking about the many resources that we can provide you guys, especially when something is going on in our family. We don't even know where to look. We don't even know where to go. So this is to help you out with all of that. And we are going to be seeing many PSAs across all platforms. Our Telemundo digital team is going to be taking care of that. Of course, this is all focused on our Latino community. And let me introduce, I have the pleasure to be speaking with Susan Brown. I want to welcome you, Susan. Thank you so much for joining us today to be speaking about this important matter.
Of course, it's my pleasure. It's my honor to be here.
Well, let me tell you a little bit about Susan. Susan has been with the Susan G. Komen Foundation since 2000, and she currently holds the position of Senior Director of Health Information Publications. Her team is responsible for ensuring that breast cancer information associated with the Komen name is safe, accurate, current, consistent, and based on scientific evidence. Tell us a little bit more about yourself. I know you have an oncology background, and we want to know a little bit more about what you do, Susan.
Sure. I worked inpatient oncology many years ago, and then I've worked about a dozen years or so in women's imaging, and I've been at Susan G. Komen for about 21 years, and been working with breast cancer patients, both in the hospital and in imaging, and then now in more public education for several decades. So I'm just thrilled to be here with you today. Just thrilled.
It is an honor to be speaking with you, Susan. And I'm going to start talking about, obviously, breast cancer, which is the most common type of cancer in American women, with the exception of skin cancer. But in our Latino community, breast cancer, I should say, is the most common cancer and the most common cause of cancer death among our women in the U.S. To have an idea, 1 in 10 Latino women in the U.S. will be diagnosed with breast cancer in her lifetime. So this is really an important matter that we should be speaking about. Let me ask you, one of the first things that we should all do is educate ourselves. First of all, what is breast cancer and what causes it?
So breast cancer is really a family of diseases where the cells in the breast tissue grow and divide out of control and form tumors. We don't know what causes breast cancer to develop in an individual person at a particular point in time, but we do know that it develops as the result of mutations in those cells in the breast. We just don't know what causes those mutations. So we have a lot to learn about the causes of breast cancer.
Now, what can you tell us about the different cancers and stages?
So breast cancer is a family of diseases. It's not just one disease. And like the members of your family, these tumors have different personalities, characteristics, behaviors, and appearances even. And so the treatment and the prognosis do vary according to the type of cancer. There are 5 stages of breast cancer, stage 0 to stage 4. Stage 0 is a non-invasive breast cancer and occurs before the cancer cells have spread into surrounding breast tissue. We can detect stage 0 breast cancer with screening mammography. Stage 4 breast cancer is at the other extreme, and it's also known as metastatic breast cancer. Metastatic breast cancer occurs when cancer cells actually travel from the breast where it started through the circulatory system or the lymphatic system, some other organs in the body, usually the bone, liver, lung, or brain. And then the cells begin to grow without control again and form new tumors in those organs. And breast cancer at this stage can be treated, but today it's considered an incurable disease.
Wow, it is really important that we know all of this because we just heard about breast cancer and there's so many things around it that it's very good for you to explain it to us in this conversation. Why did you feel it is meaningful precisely to be addressing breast cancer awareness?
Well, I think it's important to address it because if you don't know about a problem like breast cancer, if you don't know it exists, you don't really do anything about it. So you may overlook signs and symptoms. You may not get screened, or you may not talk to your family about your family's medical history, or talk to your doctor about your risk and possible ways to reduce that risk. So awareness really leads to information and knowledge, and that can be used to empower people to partner with their doctors in their breast care.
Now, Susan, there's so many conversations about this, and everything is centered on what happens when you are diagnosed with breast cancer. And like I mentioned before, Latino women are more likely to get diagnosed at a later stage and diagnosed with larger and more difficult to treat tumors than white women. In part, it is because the lack of getting scanned and following up with doctors. What are some of those preventive methods that you can tell us they can do, and how early can someone get scanned for breast cancer?
Yeah, well, because we don't know exactly what causes this disease, we really don't know how to prevent it. But there are lifestyle choices that people can make that for overall good health that may also reduce their risk of breast cancer. Things like maintaining a healthy weight, including physical activity in your routine, limiting alcohol intake, limiting the use of menopausal hormones, and breastfeeding if you can. And for women who are at higher risk due to things such as inherited gene mutations, they can consider taking medications to help reduce the risk, or even surgery to reduce the risk. But there are things we can do to find it early, and screening tests or tests that are designed to do just that. This is the time to have a medical test when you aren't sick. It's important to do that because mammograms can find breast cancer before they're large enough to be detected. Some people estimate that mammograms have the ability to find breast cancers 10 years before they would be large enough to be detected on a clinical exam. So for women at average risk, screening mammography begins at age 40. Clinical breast exams are also screening tests for breast cancer, which you don't hear as much about, but that's that physical exam that so commonly occurs with a well woman exam. And those can begin at the age of 20. For people who know they're at higher risk, the mammography screening begins at a younger age and often is combined with annual breast MRI. And those decisions are really made individually based on an individual's risk, and the decisions are made based on conversations with the healthcare provider. So those are discussions that patients or women and their doctors have to decide what screening is going to be best for them.
Yeah, every case is different, especially if you have a background of breast cancer. That's when we should be more aware of. Now, let's dive into health equity, Susan, because health equity means that everyone has a fair and equal opportunity to be as healthy as possible. And Common is committed to be removing racism, bias, and other barriers to precisely for individuals and communities experiences health qualities and disparities. You work to ensure that all people have access to high quality programs and services to support their breast health. What can we do to eliminate this disparity?
So there are all sorts of barriers. They range from lack of information about breast cancer screening, where to go to get a mammogram, confusion or uncertainty or inexperience in navigating the complex healthcare systems, fear, language barriers, lack of insurance, all sorts of barriers. Addressing common misconceptions, I think, is one important thing. So, for instance, not all breast problems are breast cancer. Not everyone with breast cancer dies with breast cancer, and not everyone with breast cancer will have to have a mastectomy. So education, information is one of the first ways to help address that disparity. We also have direct services through our care services program that can also help eliminate some of the other barriers. We have a Komen breast care helpline that's a free resource that's available for every person, survivors, those living with breast cancer, caregivers, or really just anyone that has a question about breast cancer. Trained specialists and oncology social workers can help navigate callers, patients through that complex, through our health system that I've already said is complex and can be confusing. They can provide informational support, emotional support, and then information about resources in local communities. And this service is provided in English and in Spanish. And I'll just give you that phone number. It's 1-877-GO-COMEN or 1-877-465-6636. And then for many people in treatment for breast cancer, there are financial barriers, even aside from paying for the actual treatment. So Komen does have a treatment assistance program that can help eligible people by providing financial support to help with things like housing and utilities, transportation, food, medication, and childcare, things that really can be barriers and can prevent people from completing the treatment that we know is so important. And then Komen also works on the national, state, and local levels to try to inform government action to make really broad and systemic and long-lasting change. And these are changes we need to help us end breast cancer. So we're working to protect access to affordable, high-quality care for all patients. With so many challenges facing our nation, this is really an important time for us to make certain that our breast cancer priorities are heard in Washington, D.C. So we're working in all these ways to help try to address the disparities we know exist.
Now let's talk about breast cancer in men, because they also suffer from this disease, though the risk of breast cancer is much lower in men than women. So you can have an idea about 1 in 833 for men in the U.S. compared to 1 in 8 for women in the U.S. An estimate 2,650 new cases of invasive cancer, breast cancer, will impact men and cause approximately 530 cancer deaths. Obviously, this is a topic maybe that men are not so aware of, Susan, but why is it important that we encourage men to also talk about this matter and to be involved?
So I think there are two issues here. One is that men don't know that they can get breast cancer, and sometimes women don't know that men can get breast cancer. So that's, we talked about awareness earlier. So that's important information that men should not ignore warning signs. Often the diagnosis is a little later in men because they have noticed physical changes but haven't really realized how important they are. But the more common way men can get involved is support the women in their lives who have breast cancer, their moms, their sisters, wives, partners. And the social support and that family support is really critical. We know that breast cancer is not just a woman's problem or just a single person's experience. It affects the whole family. It's really a family issue. As anyone who's been impacted by breast cancer, when women get breast cancer, it impacts the entire family.
And let's talk about the treatment and the many options that are available to treat this disease. Obviously, it all depends on the type of cancer and the stage they're on, like you mentioned at the beginning of the conversation. But what is the goal of the treatment and what treatment options are available?
So the goal of treatment is to remove the cancer from the body and to prevent it from coming back. Treatment almost always includes some combination of surgery, radiation therapy, chemotherapy, hormonal therapy, and a HER2 targeted therapy. And as you mentioned, the combinations depend on the type of cancer, the stage of cancer, information about that person with cancer, and their personal preferences. Patients are partners in their breast care, and they get to decide what kind of treatment they're going to have.
So what's the difference between radiation and chemotherapy? Because when we talk and we heard about them, we're like, isn't it the same thing? But it's not.
No, it's very different. So radiation therapy is intended to kill cancer cells that may remain in the breast after breast surgery. And it's usually surgery with a lumpectomy. So where the entire breast isn't removed, but just that little tumor in the breast. There could be cancer cells left behind, and radiation therapy is intended to kill those cancer cells. Chemotherapy, on the other hand, and along with some of the other therapies I mentioned, hormonal therapy and HER2-targeted therapy, are intended to kill cancer cells that may have spread from the breast to some other part of the body. So it's a more systemic therapy, but they're both intended to get rid of the cancer and to keep it from coming back.
Now, Susan, what are some of the sociological and mental impacts that many of the families going through breast cancer experiences can experience, and what can we do, or what do you guys do to help them out to overcome a positive?
So breast cancer is frightening. It's, that diagnosis is almost always a shock. Support is important. Getting information, getting emotional support, practical support can really help those diagnosed with breast cancer work through those physical trials and also the emotional challenges of the disease. Each person may need different types of support at different times during their breast cancer experience. Women often don't want to ask for help and think they can do it all. This isn't the time to try to do it all. It's the time to get the help you need to get through this experience. I'll just mention that families and caregivers need support too. It really is a family disease. Family members may have the same feelings as that person with breast cancer, but in addition may feel helpless because they can't fix it, or they don't even really know what to do to support their survivor. They may feel fearful, angry, frustrated, anxious, and it's important that they take care of their needs during this time, get the support they need to, just like the survivor.
Susan, and all of this information that you have shared with us might be a little overwhelming for somebody that just find out that they have breast cancer. What would you say is the first thing they need and should do?
Get information. They can go to Komen.org for information about breast cancer. They can call our Komen Breast Care Helpline to get information about breast cancer. They can take a deep breath and realize that there are people and resources around to help support them during this experience. There's a lot of information to learn. They can learn it. Just take little bites of that elephant. Take it one step at a time.
And lastly, Susan, how can Telemundo continue to address breast cancer awareness in our communities? What can you share with that? And what message do you have for our Latino community today?
Telemundo can continue to talk about breast cancer, share information and stories like Ashley's. I think that's one reason we've made progress in breast cancer in the last decade or so, is that today women and men are willing to share their stories. And these stories inspire others and send an important message that people do live with and beyond a breast cancer diagnosis. Breast cancer is scary and no one wants it, but please don't let fear stop you from getting the breast care that can save your life. Talk to your family about breast cancer. Learn about your family's health history. Get screened. Know what's normal for you. And if you notice a change in your breast, take charge and see a doctor. And make healthy lifestyle choices that may reduce the risk of breast cancer. Finally, please share this information with someone you care about and then ask them to pass it on.
And so you can have an idea what we've been talking about. There's a PSA that I would like to share with you today that we hope raises awareness and hope for a change and saving lives. So take a look. Susan, for talking to us about this matter and this exciting opportunity to partner with the Susan G. Komen. Thank you.
Thank you for having me and for shining a light on this important issue. It's been my pleasure to be here today.
And additionally, and before you go, Susan, I would like to remind each and every one of you that Comcast NBC Universal has created a matching gift program. This is aimed to amplifying your impact in our communities, and we encourage you to participate in this program and donate, if you would like, to the Susan G. Komen Foundation via My Impact portal. We all have it in our computers, and it's very easy to navigate. So our organization will match dollar to dollar up to $1,000 per employee. So thank you so much for watching. Manténganse saludables y muy seguros, y nos vemos en la próxima. Thank you so much, Susan. See you later.
Thank you.